Welcome to one and all of the diehards.
Yeah, look at this
Promising
group.
speakers that this is going to be like the best because the people who are here are either really, really interested or really, really good and supportive colleagues. And what better could you ask for in an audience? And so I'm Delia West, I'm the moderator, and I will announce to you ahead of time, I will be running around with a microphone for people and their questions as soon as the microphone arrives. But in the meantime, let's have our speakers reintroduce themselves just to help y'all get oriented, and then we'll get kicked off.
Is this on? Do I need this? Actually, I have a cheerleader's voice. I don't know if I need this or not. So can you hear me? Yes, you can hear me. So I'm Kathleen Ragsdale. I'm at the Social Science Research Center of Mississippi State University. So by training, I'm a medical anthropologist, and by way of interest and happenstance in graduate school, I went from ethnovideography and to medical anthropology, looking at HIV prevention. Then when I moved from New York City to Mississippi State, I got really interested in teen pregnancy issues and alcohol and drug use because they're all related. And from there, then I went on to be interested in issues around teen mothers and infants. So that's why I'm here today. So.
My name is Pat Thomas, and I'm a journalist. And 9 years ago, I became a journalism professor by some odd twist of fate. And so I have founded and organized, and I run a graduate program in health and medical journalism at the University of Georgia's Grady College of Journalism and Mass Communication. This is a 2-year graduate program, and we prepare students to cover stories about public health, medicine, science, the environment. For audiences large and small, we are platform agnostic, so we do storytelling in print, digital, and video formats. And I'm happy to say that a graduate of my program is over here to help me answer the questions that I don't know how to answer. And I'm the only person on your symposium panel who doesn't have a PhD, so there.
Hi, I'm Mary Roseman from the University of Mississippi. I'm in the Department of Nutrition and Hospitality Management. I'm a registered dietitian, and my career wasn't always in academics. I spent 20 years in industry. I was assistant food director for a university, and then I did marketing and human resources for a major restaurant company. And so with that, I then went into academics. So I sort of have a little bit of different background. My research, because of that, it's pretty sort of eclectic. But I love to take that combination of hospitality and dietetics and try to figure twists and turns to it. And that's why the student who wanted to look at food and how it's represented in TV was very intriguing to me. It really was her idea, but certainly something intriguing just to see how that all turns out. So,
I'm Kim Bissell. I'm also a professor in the Department of Journalism at the University of Alabama. My other job duties at Alabama, I'm the Associate Dean for Research in the College of Communication and Information Sciences. I'm the director of the Research Center in our college, the Institute for Communication and Information Research. Also the director of our Health Communication Lab. I do not my background is in sports journalism, so I started as a sports photographer during undergrad and after undergrad, and then went into graduate school, kind of got hooked on mass communication and media effects and thought, well, why not combine two things that I love, journalism and teaching. So that's what I do.
Well, thank you. The first thing I'm going to do is steal a microphone because evidently the search for the microphone didn't work, and I'm going to allow y'all to share amongst yourselves.
Unless it's taken out of my salary.
You got it. There you go. And so this is your opportunity to ask questions for the things that you were dying to know that didn't get to ask in the large room format. Anybody have any questions? There you go.
So this came up at a breakout last night about how people get excited about new technology and then they drop off rapidly. Could you speak to maybe how this compares to traditional interventions and strategies to improve adherence?
Sure.
So dealing with kids, I mean, I think you're exactly right. We had a big boom of excitement when the Wii came out, when the Xbox came out, when Kinects came out. And I think the key with things like the iPad and with the app and with what I'm doing now is that if they get excited about it and they kind of, if it becomes ritualistic in terms of, oh, this is what I do. I mean, it literally takes less than 2 minutes to complete their plate after each meal. If it becomes something that's kind of ingrained in what they do, then it just becomes habitual and it's not perceived as a task and they still get rewards. And I haven't been able to look at it longitudinally yet, but that's what I'm doing right now. So I'll be able to see the types of factors that relate to drop off or what happens, you know, if kids travel with their families or something like that, are they still tracking? Right now, if they have it at home, then they can obviously do it. If they have an iPad at home, they can do it at home. But for kids that don't have access to an iPad, they're doing it at school. So they're coming in on Mondays and recording the weekend data and then every day after that. But I think it's an interesting question. You know, we're always going to be hit with new devices and new technology. But I think, as I had mentioned, with kids and with behavior and attitudes specific to health, if we can catch them early, 3, 4, and 5, well, this is just something that you do. Yeah, you're going to have some drop off, but I do think that it's going to stick with them. I did an intervention program in 2009 where I taught PE, which about killed me, to K through 8 every day for a month.
But you were super fit, right?
Sore is really the better word. I taught PE and I taught them about food advertising. We had this whole thing. And I go into the school and the kids that were in kindergarten that are now, you know, in 5th and 6th grade, they're like, Dr. Bissell, look, and they'll show me things, you know, and it's still stuck with them. So the, you know, behavioral things that I taught in terms of exercise, the concepts that I taught about reading nutrition labels, they still remember it. Maybe not 100%, but it was all done in this fun context. So I think that helps.
Can I add something to that?
Yeah.
So actually, I think this is really interesting because I think even though the technology is always changing, that's not going to change because that's only speeding up. So especially with health educators and public health people, medical anthropologists, medical sociologists, nutrition people, we're all going to be trying to get in front of that curve, and it's really, really difficult. And that's why I think especially bringing your target audience to the table to really have them involved in the process is so important, because without their feedback, you really don't know what they're into, because we cannot keep abreast of it all. It's just impossible. You know, everybody has information overload right now, I think. So, and who in this room does not have information overload? Because I want to see how you're doing it. So.
I think it's worth mentioning also, I said earlier this morning, that when it comes to health messages as health professionals, and thinking about the content, that with technology today, some of that will never go away. And so I think that we all, you know, should be engaged in the messages to make sure they're positive messages that are out there with regard to food and diet and exercise and everything. Because if it doesn't go away and it's still out there on YouTube or whatever years to come, you know, it can continue to influence for a long time. And so that's actually a positive piece of technology today, is if it's a positive message, it can be out there a long time and get a lot of audiences that you didn't originally think you were reaching.
Other questions? So a lot of the work that you all are doing in technology involves other disciplines as well, and other people that have to help you create your technology. So I wonder if you could speak a little bit about your experiences with working with other disciplines or the development companies that you worked with, and sort of strategies for keeping those projects going and communicating between, you know, people who speak very different languages than maybe we do in the health field.
I would like to speak to that just a minute, because the journalism school, you know, when I came there, I don't think there were any scientists on campus that had ever been inside the journalism school. And that's definitely changed a lot over 9 years. But I had to reach across the aisle just recently because, I have these graduate students. They're going forth to cover health and medicine and public health. And, big data, the availability of enormous data sets has been generated by government agencies such as Medicare and Medicaid at an increasingly rapid clip. And the Affordable Care Act is going to make even more data available. And hospitals find it incumbent to release more quality data. Pretty soon we're really going to be able to know everything about our individual doctors, which states right now are kind of standing in the way of. But it came to me that, really the young reporters that I was training, they needed more data skills than I could give them. Having come up in a different world, and I'm just not I'm not a computer programmer, by training. So I found myself a computer scientist, and we started a course last semester, a data journalism course, and they learned to acquire, clean, manipulate large data sets, and they learned to do data visualizations, interactive mapping and the graphics and all this sort of thing. And, I'd be lost without that computer science instructor who, fortunately, for a little extra money, was willing to come teach this. And the feedback from the students who were in that class, who are now out in the world working in different places, has been excellent. Because even if they're not going to be full-scale coders when they grow up, they're, some of them now working in news environments and in public health agency environments where they do work with people who are big data experts, and now they know the language. Now they can at least talk to people who are more sophisticated than they are. And at the kind of other end of the technology spectrum, Debbie Murray from UJ, in her talk during the last session, spoke about the tremendous infrastructure that is the county extension agent. I grew up in a rural county in Florida, and we had an extension agent, and that's where we'd take the soil to be tested when the plants weren't doing well. But when I started training reporters by sending them out into these rural counties, which I talked about this morning, feels like the other day, I thought, well, I can't find a home for them, a physical home in these rural counties with public health agencies, because they'll be watchdogging public health agencies. That will be part of their job as reporters, is to ride herd on the Department of Health. So I thought, where can I put them with someone who would know something and have a coffee machine in a bathroom? And it was the county extension agents. I thought, well, why not? There's one in every county. And unfortunately, the UGA extension people have been really kind about this. So when I teach that class once a year, I find out who the current agents are in the counties where I want to put reporters. I send them little emails. I talk to them on the phone if they need reassurance, like, no, this young reporter will not take all of your time. You will probably see them once early in the semester and maybe never again, except for coffee or bathrooms. But really, that's been just a wonderful interdisciplinary partnership, and I don't think anyone from my journalism school had ever worked with UGA Extension before. So there's just lots of, academia does not really reward interdisciplinary cooperation a lot of the time. And
Unless you're at a research center.
yeah, she's
rewarded.
in a good place, and she can tell you about that. But I would just like to say that, it was you, Melinda, right, who said that you had made your best contact with the corporate wellness person while running, and that you are always networking. Mm-hmm. To which I can only say amen. Some of the most profitable interdisciplinary, and I don't mean money-wise, I mean intellectually enriching, fabulous, exciting collaborations I've ever done have been founded in social conversations. So it's always who you know more people than you think, and you can always meet new people. So, get out there. Don't be constrained by all those silos.
I'd like to answer your question also in the fact that when I was 30 years old and a registered dietitian and I got hired by an international restaurant company, big chain, I did not realize I'd end up in marketing. And I got there because of my being a registered dietitian. They wanted a director of nutrition at the time for their baked and their broiled line. And I eventually was over the marketing department over those 10 years. Now, how did I do that? I learned marketing, I learned technology, I learned all the terms and everything that was needed that was never a part of my curriculum as a student and in any course I'd ever taken except my marketing course as an undergrad, which I'd long forgotten. So what I would suggest to anyone is you hang out with those folks and you find that their expertise, if when you value that and listen to what they have to say, just be a sponge and just listen to what they're saying and before long you know what to do. And so I've been on many movie commercial shoots. I've done tons of food photography through the years, etc. But I always loved just being around the experts and just being a part of it and learning the lingo and giving my expertise when it was asked for, but also sitting back and just observing what they were doing. And so that is certainly something I tell students in class, your job's not going to turn out like you think. Your career is going to be so different. I said, so just whatever you do, have an open mind, be a sponge, learn anything and everything you can because you never know where you'll use it. And that happens.
I come from a discipline where studies of health are. People in other disciplines look at us and like, what are you doing? You're in communication. You're in mass comm. You have no business studying it. And so I think we're at a little bit of a disadvantage because when I've written grants and things like that, it's like, okay, you have no expertise in nutrition, exercise, physiology, and they write all this stuff. It's like, so basically I know nothing. So starting off with this app program, I didn't have any money. I didn't have any connections, so I went out and bought like the dummies guide for coding, and then I went back and I was like, I need the next book down, like the idiot's guide or whatever's lower, because this is way over my head, and I couldn't get it, and I knew I couldn't get it. So what I did was I put out a call for students in our computer-based honors program, and because I thought, well, if they're able to write the code to create this app, then they can get the credit for it. And the app is going to be free to schools, but it will be downloadable for like 99 cents, and that student will get the money. So in terms of the rates, he gets it, I get the data, but he gets the money, which was fine because I needed work. So there are a lot of students, undergraduate and graduate, who are willing to do stuff if it seems like, oh, there could be some potential or possibility for me. And you have to, weed through the pile a little bit. But all of the students that I had nutrition students that were helping me with the food library. So I got a lot of free help because I didn't have much money to support it. So it's a little bit of begging and trying to sell what you're doing.
So this is great because I think Kim did a great job of illustrating how leveraging the resources around you can really pay off. And so at my center, at the Social Science Research Center, our director is very long-range, long-thinking, Dr. Art Cosby, someone I really admire. So I recommend working for him. He's the best boss I've ever had. And he started the Media Collaboration Lab at the SSRC, and they actually partnered with me on the eBaby project. So we had an in-house organization where I knew I could go to constantly and get feedback. And what the Media Collaboration Lab does is they have interns from the Department of Communication, and they work at the lab. And so that's how they're leveraging, how they're getting free student labor that's also enthusiastic about what you're doing. And but one of the things I talked about in my presentation this morning was the issue around sustainability. And that's actually something that we're really having a difficulty with eBaby because USDA funded phase 1, and then I had a internal grant from the Extension Service. They funded phase 2 of the project, and now I'm looking for that phase 3, the sustainability component. So I'm going to tell you guys what I'm doing in terms of leveraging. So I ended up finding out that we have some very small mini grants, $2,000 grants, but that's seed money for some pilot data. So I have connected with a Department of Communications professor. She's teaching a class called Elements of Persuasion. We're going to turn that into a service learning class, and there's 2 sections of it. So they'll compete with each other to do a public campaign for the eBaby project for sustainability, because we really need to drive these teen mothers to the site. So then one of those, I have a board, including myself, the professor, and my other colleagues from across all disciplines. So extension, outreach, the communications department, arts and sciences. I have 2 librarians who are dynamite. And if you guys don't know that your librarians could be a hidden gold mine, because I did not know this until about a month ago. And they are so on top of everything with media. So they're my panel. They'll judge it. Then the student winners will then, we'll have them present their winning competition at the MSU Undergraduate Research Symposium. So the students get something and we get something. And then I'm hopefully going to take that sustainability program and then turn that into an NIH grant. And that's my goal. So that's leveraging, right?
Well, good luck with that.
Thank you.
I like
Thank you.
some of the creativity. I'm
Yeah.
going to ask a follow-up question for those of you who've done things related to apps and you're using the students who are available across the board. And I'm kind of interested in your experiences, given that they're students, they're free, but they are students, about your beta testing and how many iterations, and because that's actually one of the things that'll slow you down, but it'll also make or break you one way or another. So I'm kind of curious in what your personal experiences were about how many beta versions and how you went about refining your apps.
So basically, I found my computer-based honors student in February, and he was graduating the first weekend in May. And I needed to get pilot data before he graduated. So we were on a pretty tight deadline. But what I did was, before he got picked, I had the nutrition students working on the food library. So it took him probably a month to get the first round. We had to do the graphics. I had one of my own students do the graphic design. It was a competition, coming up with the little fruits and vegetables and their characters. So the logo was designed by a student. All the little fun pages, those were done by students. But it was competition based. So it took him about a month to get it all together, and he and I kept going back and forth just in terms of the way that it looked, and we want, the plate to be this big, and shifting the food library around. And then I immediately went into schools. I had 4 iterations of beta testing, and it was basically, I would go into the schools and the kids would say, well, where's this? And I would think, either I don't have it or it's probably in a category where it doesn't belong. So it took a lot of that, subtracting foods, adding foods, moving them around, just because I wouldn't always be there to help them find the foods. And then understanding what serving sizes would be appropriate, it took several rounds. So as soon as I would come back from the schools, I would download the data. I have a button on the app where it's like upload data, and I immediately get it as an Excel file. I would go through it within 24 hours, send it to my student, my computer-based honors student, and within 2 to 3 days, he had made the corrections. So he worked fast. We both had kind of a goal and objective, and I made sure that he got recognition on Honors Day and stuff like that. So, we kind of worked together collectively toward you've got to have this in April before you go away, and then I'm stuck.
So mine actually wasn't an app, so it's a website, and then it's videos that are on a YouTube channel. And I cannot tell you how many times we went back and changed and corrected, and when we got feedback, we would change the music or get rid of the dancing vegetables that we had already started to put into the prototype and things like that. So it took a lot of iterations, and I think the main thing is really important to stay on budget, because as all of you know, budgets are really important, and you don't want to blow your budget, especially right off the bat. So having a clearly outlined goal so that you're going step by step by step can really help you stay on track, and monitor your students and help them stay on track. And as I said again, keep your community advisory board, your community people really involved, and that way you won't go down the wrong road and then have to go back and start down this other road. So.
So you all were just talking about funding challenges and trying to find funding. Has anyone considered, in the whole thematic of technology, going to crowdfunding and looking at crowdfunding as a source of income and money for research?
I have to say that's crossed my mind. Kickstarter looks really compelling. I just had someone in our community actually did a Kickstarter project for. She is a community gardener and wanted to, to increase her chicken production in the area. And I have thought about that, but for me, I think right now, that's almost too much trouble. Like I know how to write grants, I know how to get money, so I know how to negotiate that territory. So, I might do Kickstarter maybe down the road for some kind of little interesting thing. I don't know. It's crossed my mind. So.
There is one just for science.
What's it called?
I don't remember,
Okay.
but I know there is one just
Okay.
for science. I've sent it to Diane.
All right. Cool. All right.
I don't recall it.
Fortunately, I'm not resorting to Kickstarter to run my program, which is a good thing.
So yes, I've thought about it. The short answer is I'm on a NIMHD grant right now. I'm a PI or a co-PI on that. And there's a lot of emphasis right now in the College of Communication. We're not a well-funded college. And so as associate dean, there's pressure on me to get, to raise the bar in terms of the money we get externally from federal funding agencies, Robert Wood Johnson, places like that. So there's a big push for me to be writing grants and helping others write grants. So that would be, I think, a simpler way to do it. But what I'm trying to do is the other part of my job and say, oh, lead by example. Yes, we can do it. And they don't think we can because we're not experts in anything. But the key is partnerships and co-PIs who do have the expertise and stuff. So on one of the grants under review right now, I have a child development expert, a nutritionist, kinesiology, and human environmental science. So I have all these different people on, and I'm just on it for name because I can do the media stuff.
Come right back to you next.
Hello, I'm Felicia. I am in the midst of dissertating, so I had to write my question down because my thoughts are all over the place. So as a new scholar interested in health and tech, and by new I mean I'm a trained journalist, I'm a graduate from Pat's program, and I'm also a communication studies person, so I'm not even in health, so I have this similar dilemma. In particular, I'm also interested in social media and grassroots health influencers, so people who are able to impact people's health in their communities, kind of with no expertise at all. I'm having a difficult time wrapping my head around designing tech and specifically social media-based interventions without having the evidence-based approach to rely on. I think someone talked about that a little bit today about when you don't have that framework, and a lot of the times we don't have it because so much is happening so quickly and rapidly with social media that we don't have the facts to back it up. My favorite Herman Cain quote. So I just wanted to know if you all had any advice on how you've been able to navigate that, specifically looking at health and tech, and how you are able to approach your thoughts and ideas about designing interventions in the future, not having this large history of data to rely on.
Yeah, thank you. That's a great question. So what we did was we actually partnered with Just-in-Time Parenting, and that's a USDA program that is designed for new parents. And so actually the evolution of eBaby was a really interesting project because
So that's already considered backed by evidence.
that is
So you're
scientifically
piggybacking on
that's
an evidence-based
scientifically scientifically accurate information that's already out there in the public. So what happened with eBaby, I was actually in another meeting on Robert Wood Johnson grant and ended up having a very brief side conversation with a graduate student who was telling me that he knew I was interested in teen pregnancy outcomes and infant feeding outcomes, and he said, one of my best friends in high school was a teen mother, and one time she was feeding her baby soda pop out of a bottle, and that blew my mind. And I thought, oh my God, that must have just burned that little baby's esophagus, to have this acid in his throat. And I said, well, I said, I know that you said something to her about it. What did you say? And he said, I told her that probably wasn't a good idea. And she said, well, if it's okay for me, why isn't it okay for my baby? And I thought, if one teenager thinks that, she's not alone. There are a lot of teenagers thinking that. So I immediately went to my office. I literally walked to my office and wrote the grant that ended up becoming the eBaby project. And part of why I got funding for that was because I was using a USDA program, and I was actually taking this scientifically accurate, evidence-based program and then trying to disseminate it to a completely new population. So what happened, and I think part of this is what you do with what makes our job so exciting. I say I have the best job in the world because I'm always learning new stuff. I'm always, getting online and looking for stuff. So I didn't even know about just-in-time parenting until I started looking at the USDA RFP. So this is the call for proposals, and I thought, how am I going to make what I'm doing, what I'm interested in, fit into this proposal? And so I ended up going online and looking at what the extension.org site had available. I saw this program. I was like, this is just-in-time parenting. So what's this about? When I started looking at the program, what I realized that this program was really designed, the pictures and the text and how it was all put together was really designed for much more mature women who were also probably middle class, more educated, and had higher incomes. And I thought, teen mothers will be turned off by this. And that was what gave me the idea for eBaby. And that's how it started, and that's how it grew. And what was nice about that, and that actually helped me to stay in budget, they had already done the science. So the science was existing. So I'm leveraging their science and expanding it out. So I'm a complete believer in leveraging. So.
Yeah. Well, and on any research project with a PhD or a master's student, if you can find out what's already out there, but put your new twist to it, because that's really what you're doing, is either looking for a brand new, unique idea or taking something that already exists but putting a new spin on it. So that is the approach you would want to do. Is there's a lot of stuff out there, but it maybe needs to be fine-tuned, or something new added to it, a new twist, something unique, a new target group, like what you did by going from more mature women to teenage pregnancies. All those types of things can be done easily within your dissertation. Yeah.
And I think if you start with data about user statistics, so here's what we know about, say, adolescent youth and mobile devices, or adolescents and screen time, or whatever it is. There is a ton of literature that looks at the use of specific forms of media, whether it's newspapers, magazines, advertisements, the internet, on how it can be helpful in conveying health information. So what you do is you start with statistics on the new media that's basically not studied, and say, okay, here's what we know from existing studies or existing literature, and say, here's why it's important to study it. And that's what I do all the time. And if you look at the internet, there's a litany of studies on the way teens use the internet for information on sexual health, because they don't want to ask people the question, so they go to the internet. So you can find a ton of information. Is the internet different from social media? Sure, but you can still make a little bit of a leap, because the media are constantly evolving and changing. Any media scholar or reviewer is going to know that. So that's what I would recommend.
And also remember, by grounding it in some sort of theory also is a good way to go, also by adding a new twist to that existing base for that. So.
I think you got that covered.
Hi, I'm Alicia Dahl from the University of South Carolina. Dr. Bissell, you kind of just touched upon this a little bit. Right now, I think there's so many avenues for people to get information through apps, through websites, through print, social media. And I'm just wondering if you guys can speak to how you make your sites, articles, apps the go-to place for people for information. Because, Dr. Bissell, I know earlier you were talking about misinformation. So if somebody's going out and asking Google their question, and they're coming up with blogs that, stay-at-home moms are writing, or that it's just misinformation about a new diet fad. So how do you stay competitive, and also how do you become the go-to place for people?
It's really an excellent question, and I'm sure everybody can answer this. It comes down to a couple of things. I mean, first of all, the app is going to be free for schools. So you want to make it accessible to anyone. And if you're not downloading it, within a school, it's going to be 99 cents. You want to make it accessible. The second part of it is the marketing angle. You have to promote the heck out of it and talk about the benefits in terms of working it into the health curriculum. And what I've done is I've kind of sold it as, okay, we don't have standardized testing on health, so it tends to be something that's dropped off the radar in elementary and middle schools, but here's one way that the kids can get that health education component, and the teachers don't have to do anything except hand them an iPad. So I've tried to kind of pitch it as you can incorporate this, and it frees up your teachers. It doesn't require anything on them in terms of time, and it's just a little bit about shameless self-promotion. So it's not currently downloadable from the App Store, but when it is, I have press releases that are going to go out to a bunch of different places, hoping that people will use it. It will get reviews. It will go up higher, in the App Store when you search for Track My Plate or stuff like that. So, it's shameless self-promotion, but it's selling it in a way that it's like, okay, well, even if I spend money, it's 99 cents. I'm going to send out stuff to parenting magazines about the app, everything. And I'm a journalist by trade, so I can do that pretty easily. But I think that's the key, getting people to talk about it.
Information overload is kind of an old problem. And long before there was Twitter, particularly in the area of health, there were people bombarded with all kinds of junk mail and what have you. I have an elderly mother who's never met a promotional flyer for a pill or nostrum that she didn't just love. And I also used to be the editor of the Harvard Health Letter, which is a large consumer health newsletter owned by the Harvard Medical School. So I know a little something about this, and it really comes down to critical thinking. We're a society that is really devalued thinking critically and skeptically about what information is likely to be trustworthy and credible information versus what information is just somebody out there to make a buck. Every time we have a health crisis, this is writ large, there's always someone, when there's a scare about anthrax or flu or Ebola, there's always somebody out there wanting to sell you, old bleach in specially aliquoted bottles as the magic cure for whatever this is. So, all of you who work in the sciences and the health arena, remember that as scientists and researchers, you have an obligation to communicate with regular citizens to try to help the people around you, your grandmothers and mothers and little nieces and nephews, to help them make more critical judgments about what information is worth paying attention to and what isn't. And a lot of you, if you have good careers, you'll be funded by taxpayers. So you need to talk to them. And that is also how I see the role of the kind of journalism that I've done and that I try to teach my students to do, is people really need to be able to submit information to tests, simple tests. If it sounds too good to be true, it's too good to be true. If it's a study based on 7 people and a cage full of mice, it's probably not something you should use to change a health behavior. So you all have the capacity to be, health educators and media literacy teachers, each at your own way. You do. And I hope you get out there and do it.
And a skill that I often try to teach that I learned, through experience in marketing is to think big picture first. What is it that I really want to communicate? What is it I really want to tell? What is that vision? And before I get into tactically how am I going to do it and what's it going to say. But we have a tendency, especially certain personalities or certain professions, to be detail-oriented first and big picture last. So that is one technique that I think has always helped me is I try to see the vision, the picture first before I get into the details of how I'm going to do it, what I'm going to say, where it's going to go, et cetera, to have that vision first.
And I also think that it's really interesting to think about. I think probably most of us here are social behavioral scientists in this room. And actually, it's a very creative process. It's just that we've been taught that it's not so creative, but it's so much fun. Like the eBaby project was so fun. And I hope that came across when I talked about it, and I hope it's coming across right now when I talk about it. And one of the things that that we have to think about is how we can actually be creative and capture that audience, because we're all competing for that audience, right? And one of the things that the CDC did that I thought was just amazing and really cool, and I actually emailed that to my sister and to a lot of other people, it was the zombie apocalypse. So are you guys familiar with that? So basically they were trying to get people to think about disaster and what would happen in disasters, because people are not prepared for any kinds of disaster really in their families. So they kind of piggybacked on this whole zombie craze, and they made this zombie apocalypse. Like, what would you do if there was a zombie apocalypse? And they actually got some really great feedback from that, and they got people to actually think about disaster stuff. They also did some really interesting stuff on the H1N1 epidemic, and I think that was in 2009 when they were doing some really interesting social media stuff, and we actually wrote a paper about what they did and how they did it. And they had some really creative ways that they did some really good motion graphic videos, where like one was just like a house like blowing down, and it was so spot on. I mean, it really got the message across. So I think being creative, we're already thinkers, we're trained to be thinkers, but letting our minds out of that box and to really have fun with what we're doing is a really great way to go. So,
Does anyone watch House of Cards? No. Okay. So
I like the British version best.
Okay. Well, the main character is a politician. He's a terrible human being, but despite that, he really established really establishes a relationship. I don't want to tell you what happens, but really establishes a relationship with the journalist. And my question is we as researchers, should we actively seek out journalists instead of waiting for them to come to us? And if so, how and when should we do that?
Oh, Colette. So there's a line there, because as I know what happens to that journalist. I've seen the whole thing, but no, but in my career, and I think most people who've been science writers, there have always been scientists who we refer to as rabbis. The people who have taught us a lot, who are a sounding board, a reality check, a shit detector for us. And their names probably never appear in our stories, but they're people who've been big influences, rabbis, gurus. And so I think scientists can really help journalists by having that kind of personal, yes, you can have a serious conversation about the issues of the day. I would come to you if I was confused about something in your area, and I would invite you out for a beer, and I would say, Colette, explain this to me, because I don't think I understand this science. And I've done that with 1 million people. And so, yes, you can help in a good way set the news agenda by helping journalists discern what is important, what is really coming out in your specialized field that otherwise they wouldn't have the up close and personal with that field to know. And then at the other end of the spectrum, there are the scientists who journalists impolitely refer to as media hoes, because they have never met a journalist that they didn't want to put their toupee on, put on a fresh blue shirt, and be interviewed on camera. So those people we tend to distrust, because we figure that they are just empire building. They're trying to set themselves up for more and better grants, and maybe to be the president of the Ford Foundation when they retire. We don't know, but we're pretty suspicious of them. But yes, you can absolutely, if a journalist interviews you, you've been interviewed by at least one of my students. So, when you know something else big is coming out in your field, and say she goes on to be the famous TV producer that we think she'll become, there's nothing to keep you from emailing her in the future and saying, hey, Hyacinth, there's something great coming out in Nature. It would make a wonderful, wonderful news item. And I don't think a lot of journalists are going to tumble to it. Really, absolutely. You can definitely talk to journalists. Time to make friends with a journalist, not during a crisis. Nope, not the best time for either of you to become friends. You want to become friends during times of calm. It's my recommendation. And you should definitely talk to them.
here's the thing about it. We're at a point right now where I think we lack translational research. I get in my own little mass comm bubble, and quite frankly, I've done a pretty poor job sometimes of taking the time to understand what other people outside of mass communication are doing. But I think what we have to do as scholars is take that next step in terms of breaking down our findings as simple as they may be, and making them meaningful to not only people outside of the discipline, but to the public, especially as it relates to health. I mean, you can, if you're fortunate enough to have a PR office or media relations office in your college, if they get an abstract of your study, they probably are not going to understand what it is. The good journalists are going to come to you and say, okay, break this down, and what does this mean? But a lot of them aren't, and they don't understand it, and they don't want to ask questions, they don't want to look stupid, so it just gets tossed. So what we need to do is take our findings and break it down into meaningful little chunks. Here's how it can help the public. Then it gets snapped up in an instant. And in terms of funding, we all have to have a dissemination plan, and that's not just random dissemination, but it's disseminating to the proper publics, which is a PR term. But I think that's, yes, definitely you should do that. And you should, and this is what I try to do. I try to have sort of my abstract that's in the scientific terms, and then the abstract that could go out basically as a press release. And I tell my graduate students to do that, and we're kind of looking to do that across campus at UA right now.
That's a great idea, and I would add to that, when you send your work to a journalist, ask to always see the final copy, because oftentimes they're very busy and there might be mistakes made, and I have had that happen. So always you want to double check. Sometimes, journalists, and Pat can speak to this, they don't want to have you look at it that second time, but it really is important because you want to make sure that you're trying to get this little bit of information out exactly how it's intended to be translated. So that's very important. So.
When you do an interview with a journalist, you forfeit that right. It's a basic tenet of ethical journalism that your loyalty is to your reader, and that you are to be independent of the stakeholders. So most responsible journalists are never going to let the sources sign off on the correctness of the story, and if they work for a major news organization, the editors are going to forbid that. It's going to be against company policy. That said, of all categories of journalists who cover hard science, basic science, are the most likely to be willing to call back a scientist and read them their quotes, or read them any place where they have translated your technical material into metaphor, figurative language of any sort, with the goal of making it more accessible to the general reader.
And it's up to you
But
to
they're not-
ask for that. So you ask for that.
But do not ask to read the story. They will think you know nothing about journalists.
Right.
What you say is, at the end of the interview, I will be happy to confirm my quotes or help you with any explanations that you
Depending on your
craft.
relationship
Call
with them.
me.
Right, depending on your relationship with them. And that's something too, because they're building relationships just like you are.
Yeah.
So they don't want to burn that bridge with you, and so it's a two-way street.
But there are many fine media outlets that would fire a young reporter for letting you sign off on the story. So you should know that.
I do know that.
So, yeah. So just saying. So I don't really advise that. I teach media training for scientists, and I suggest the much gentler wording of your willingness to help confirm for accuracy. But believe me, nobody's got more riding on the accuracy of a story than the journalist whose name is on it, which it is wise for you to remember.
Can I take a prerogative to ask one question? I realize as I'm running around here, what metrics do you think, you're talking about stuff that's going out into the world. How do we as scientists and scholars evaluate the impact? What are the appropriate metrics to be using, whether it's TV, whether, placement of foods, whether it's utilization of a website or an app, or any of the range of technology within your own areas? What are the appropriate metrics to be able to actually have convincing science to convince Pat that there's something here to disseminate? No, I'm the
Well,
scientist. Well, I mean,
I hope I understand your question. So I'm a little, but I felt like my presentation had a metrics in it where I had found if what you're asking, where we went out and tried, that was one of the hardest things to do, was to find a way to actually be able to, in a scientific way, discuss how food is eaten, shown, or viewed on TV, shown and talked about on TV. So metrics is hard in some cases because there may not be any.
Right. and
So
I-
you may, if I'm understanding your question right, you may have to, that might be one of the unique things of what you do in terms of your contributions to the literature, is to create a matrix. Because somewhere the RRR came from, and it came from those two scientists who did it, and we modified it. But I think that there won't always maybe be a matrix that you may have to create. Did I understand?
metrics, outcome variables. So you discuss, for example, you discuss the proportion, the over representation, if you will, of snack foods. The question that comes to my mind when I see that is, well, what impact does that have on behavior? In other words, the so what question, if there's
Right.
more snacks, does it have impact? Or if you change the placement of food or how healthy
Right.
the food is, does it have any meaningful impact on the outcomes in terms of people's intake and
Right.
or their obesity?
And there was
so-
that question today, which I thought was great from the crowd, where they asked me that question. And to me, I see that as future research. You know, we answer one thing, and all it does lead to, as scientists, more and more questions. And we were challenged by Dr. Lair yesterday morning that it will always be the next question, the next question, the next question.
And I think that's pretty much my question in essence, and you've articulated it far better. What would be the next way that you would
How would I
take
do
your
this?
research to have an outcome that is actually directly meaningful for obesity prevention?
I've thought about that. So if anybody in the room wants to do any research with me, here's what I think we should do. I think we should tape again, and at the same time, I think we need to find out first if we could get enough children of the shows they are watching, and then evaluate the shows, but then also ask them behavioral and attitudinal questions of how they have been influenced by those shows. So we'd have to do it two parts. We'd have to evaluate the shows, but more importantly, we would add to it a survey of them, of their attitudes and behaviors based on those shows.
So your thinking is that they're aware of the impact of viewing on their behaviors.
They will hopefully be when we ask them the questions. I don't think most of us watch a TV show and we don't sit there and evaluate, oh gosh, I saw a piece of candy versus I saw an apple, so I'm going down to the kitchen, I'm going to go get that piece of candy. But if you ask them properly in a survey, I think we could find out how much the content in those TV shows may be affecting, their level of snacks, types of snacks they eat, different things like that. So I think that is the next wave that needs to be done.
So the thing about studying the media and working in any type of social science is that there's a tremendous amount of unexplained variance. So when I get excited about like a 0.38 R-square value, and my friends over in STEM are like, yeah, you got nothing. It's really difficult to go outside of my discipline and convince anyone that it has that so what factor. So I always have to start with, okay, it's very complex. It's not just media. It's not just demographics. It's not just this. It's a bigger picture, and we're one part of that. But I think the key is in that, in what I do, every single study that I've done, I add more and more measures, which makes it very, very difficult for the poor, sweet kids who have to fill it out. But, I've got the individual factors and the social and the media and all this other stuff so that I can round out the study as best as possible, control for as much as I possibly can. And then it just comes down to saying, in hard science, you can get these R-square values that are off the charts, but we're dealing with people, and everybody is different. So I think it's just a little bit of explanation about what we do. Not everyone buys it, but.
Oh, so I wanted to just add on to that. I think also it's very important when we're thinking about evaluation, like how we set up those programs. I did a evaluation for HealthWorks, which is it is an interactive. They don't call themselves a children's education center. They call it like a fun fantastic center, and they really are fun fantastic. It was like another great project to work on. So what we did with them was we actually had a pre and post test. We had a control group and an intervention group. So the control group got the pre-test, then they went to HealthWorks, they got the Be a Food Groupie program, and then they got the post-test. The intervention group got that. The control group got the pre-test, the post-test, and then they went to HealthWorks and got the Be a Food Groupie program. So we were able to compare this across 11 schools with lots of children that were matched according to their race, ethnicity, poverty levels, and on school lunches, and also on their, because test taking is linked to language skills, so on their language skills. So I think how you designed your program so that you have that evaluation component is really difficult, and it's also the fun part of it, because that again is where you're trying to think how you're going to answer the questions that you need to answer. So yeah.
You have time, one more question. Here you
Okay.
go.
So you've discussed a lot of different types of collaborations today with the media, with other departments in your university. I'm curious how you see yourselves partnering maybe in future projects more with industry, so with technology companies or developers, to try and stay maybe a little closer to the front of the curve and maybe help with uptake of whatever you're designing kind of in the university like incubator.
Well, the Knight Foundation, the Gates Foundation, and Mozilla have funded a tremendous number of new media innovations. New media is, of course, now an old term, but what I mean is weird digital stuff that we couldn't even imagine, and that on which they've spent. It's not exaggerating to say billions of dollars, mostly handed out to teams of 3 young people in their 20s. The trouble is that some of these innovations have been aimed at answering trivial questions or solving problems that no one needed solved. So I think a guide for any kind of research, whether you're going after corporate partners or cross-disciplinary partners or multi-institutional partners, is this: are you asking important questions? Are you asking questions that people need to know the answers to? Because I think sometimes in the rush of academic research and certainly in the rush of development of new fun things to do with your smartphone, we are often dealing with trivial things here. And so I think it's important for researchers to ask important questions and not go right into the reporters about it unless you get a significant answer. And I teach young journalists this is the most important thing. It doesn't matter what journal it was published in. Did they ask an important question? And does the answer matter? That's the big so what factor that Kim was talking about. Does it matter to us? A lot of apps, they kind of don't matter. But I'm sure other people have better answers.
Well, and I'm going to invite you to come up and ask them individually, because the gong came very quietly at the door, but nonetheless it did. So I want you to join me in thanking our panelists for hanging in for a very, very interesting breakout session. Thank you so